Welcome to a new episode of Medicine in 3 minutes. We go straight to the point. The subject is briefly made clear and often illustrated. Let's start. Today's topic is hypopituitarism. Hypopituitarism is a lesion in the hypothalamus and pituitary region. Most common children is craniopharyngioma. Growth hormone and gonadotropin are lost early, and ACTH is lost last. Selective hypopituitarism means decrease of secretion of only one specific hormone. Panhypopituitarism decrease secretion of most or all pituitary hormone. All pituitary hormone panhypopituitarism. Only one selective hypopituitarism. Hypopituitarism, primary addition plus primary hypothyroidism. Growth hormone and gonadotropin are lost early. ACTH is lost last. The diagnostic is based on blood tests, specific scan, look for underlying tumor. Rare disease and diagnosticated in traumatism brain injury. Most hormone can be replaced by tablet or injection. Deficiency of all anterior pituitary hormone is more common than individual hormone deficiency. Anterior pituitary deficit, gonadotropin, LH and FSH. In women, amenorrhea and infertility. In men, loss of facial, scrotal, and truncal hair, decreased muscle mass, anemia, loss of libido, and osteoporosis. In children, it is associated with delayed puberty. Most common lesion of pituitary adenoma, amenorrhea galactoria. In women are juicy, men are dry. Men, erectile function drop. Growth hormone deficiency causes fatigue and decrease muscle mass. Growth hormone deficiency is the most common symptom of hypopituitarism seen in Sheehan syndrome. Pituitary apoplexy, prior adenoma, headache, altered mental stature. Sheehan syndrome, postpartum necrosis of the gland, inability to lactate. Necrosis of the gland, blood, the end of pregnancy and giving birth. No lactation. Compression of chiasma optic. Bitemporal hemianopsy. Craniopharyngioma is most common in children. Slow growing brain tumor. If large tumor, vision problem. Increase urination and thirst. Standard growth. How to blame for recurrence after surgical removal? Because recidive is very frequent. Adrenal gland. Glomerula, fascicula, and reticula. Glomerula, mineralocorticoid, think salt. Fascicula, glycocorticoid, think sugar. Reticula, androgen, think sex. Medulla, epinephrine, stress. Secondary, adrenal insufficiency by lack of ACTH from anterior pituitary is similar to Addison disease. It can cause Addison crisis, which is life-threatening. Addison disease, asthenia, anorexia, hypotension, hypoglycemia, digestive disturbance, and depression. Asthenia, anorexia, hypotension, hypoglycemia, digestive disturbance, and depression. During hypopituitarism, there is no skin symptom. Melanodermy is missing. It's all about Addison, but without melanoderma. Electrolytic imbalance might result hyponatremia after delivery by inappropriate antidiuretic hormone, ADH hypersecretion. Think ADH, think about diabetic insipidus. Hypothyroidism, decrease of TSH, gout, mood swing, depression, dry skin, sensitivity to cold, constipation, bradycardia, high loss, irregular bleeding, and obesity. Congenital hypothyroidism, cretinism, short stature, mental retardation, delayed motor development. Treatment options depend on the type of tumor and its size. Prolactinoma, cabergoline, dopamine agonist. Tumor is large. If tumor is large, radiation and surgery. Prolactinoma, progesterone antagonist. Somatotropic adenoma octreotide. Surgery is a common treatment for pituitary tumor. Transphenoidal adenectomy. Hypopituitarism, think about primary Addison without melanoderma and primary hypothyroidism. Primary Addison, asthenia, anorexia, hypotension, hypoglycemia, digestive disturbance, and depression. Hypothyroidism, dry skin, sensitivity to cold, constipation, no lactation, bradycardia, high loss, irregular bleeding, mood depression, and diabetes insipidus. Thank you for watching this episode of Medicine Intermediate. Would you like to click the button like, to subscribe? Your comments are very welcome. Thank you.